I have started the recording, and let me just say that if you want at any point to make a comment and want to do it off the record, to just ask me to pause the recording, and I'm happy to do that. Otherwise, this session will be eventually placed on our website, and that's Catskills Addiction Coalition.org. Catskills with an S, addictioncoalition.org. We want these sessions to be very interactive, and there's several ways you can do that. The first is you can go to the chat box and you can post a question or comment there. We will be saving the chat, so we capture all of your comments and questions to inform our work. But I also want to point out that you can also save the chat at the end by going to the three little buttons at the bottom, clicking on there and just say save the chat, and it will download at the end of the session. You can also raise your hand. Now, because we're going to be showing slides, I may not see your hand. That may not be a real effective way to do it. So if you've raised your hand and you want to jump in, just jump in, unmute yourself. Otherwise, I'm going to ask you to keep yourselves muted. We want to reduce background noise, and if I'm hearing noise from somebody, I'm going to go in and mute you myself, but you can always unmute yourself when you go to speak. We are going to ask you at the end to do an evaluation of this session. This is the first time we've done this online approach to our community action event. And I will post that link. You'll also receive an email. And in that email, you will have the opportunity to complete the evaluation as well. But if you can do it at the end of this session, just by clicking on the link that I'm going to post towards the end of the session, please do that. You also will receive an evaluation at the end of the week, and we ask you to give us feedback on the whole week. That's really important to us as we try to figure out, do we want to do this again in 2021 or some hybrid version of it? You also, I will be putting in the chat a link that you can go to fill out a very brief form and get a certificate of attendance of this session. And again, you'll be getting an email with that information, but I'll put it in the chat box and you can do that right away at the end. We're asking that everyone in the session follow a few guidelines for today's session. First, we ask that you do actively participate. We encourage your active participation in this session. Julia's already posted in the chat that she really welcomes people peppering her with questions. Second, we ask that you do so respectfully and be respectful of all in the room. We want you to feel free to raise questions, to disagree, to raise points that some people may feel uncomfortable with, but to always do it respectfully. We want to model the kinds of conversations that we think our society should be having. I will be moderating this session. I'll do my best to monitor this chat and to bring your questions and comments forward. If I miss it, please know it was not intentional. You can always raise questions at the end and make comments as well. And finally, all questions are welcome. If you have a question, somebody else probably has the same question. I will try to take questions, break in with questions for Julia throughout. You can jump in. But otherwise, if I miss it, we will go get you at the end. We're very excited about this session. This is a really important session for a problem that actually, before Julia got involved in this, we didn't even know was much of a problem in our area. Julia Reichel is the project director for the Rural Communities Opioid Response Program based out of Margaretville Hospital, the Health Alliance of the Hudson Valley. I have the great pleasure of co-chairing the Catskills Addiction Coalition with her. And really, we've made enormous progress over this past year because of her. She's really amazing. And she also is a master's student of social work at the University of Buffalo. And she sits on the Middletown Town Council. So she doesn't have enough time on her hands, I'm sure. And I will just turn this over to her and say deep gratitude, Julia, for all that you are doing for us. Thank you.
I am so excited about this and to be unmuted while I do it. Okay, So the thing about neonatal abstinence syndrome is that it's a problem that has a name that is very misleading. And we're really lucky to have a mom here with us today who's actually going to talk about how she experienced being pregnant and having kids in our community, while also dealing with substance use disorder. And that's really the heart of this. Like I'm going to intro why we talk about this through the lens of neonatal abstinence syndrome, but highlighting the stories of folks is super important. So I also want to say that we have a neonatal abstinence syndrome peer, Alicia Griffin, on our call as well. She's part of this grant that's supporting this work, and she's going to tell us how she's working with folks to support them when they're parents, right? When they're pregnant or expecting to be pregnant or have young kids. She'll be coming in at the end to sort of tell you what she does with us. But I'm really, Mary Lou and I talked last week about doing this, but I didn't realize she was going to come on until like a minute ago. And I'm so excited to have her. It's so great to have people sharing their personal stories. Sorry to get a little giddy. So Mary Lou, hold that thought for 1 second. I do want to just tell you what it is through the public health lens that made us focus on neonatal abstinence syndrome. Okay. Neonatal abstinence syndrome and something called neonatal opioid withdrawal syndrome are used not interchangeably, they're two different things, but they're both used to highlight the problem of people having babies who also have substance use disorder or have some kind of interaction with substances or drugs that affects their experience in the larger world, right? So I first heard of this when I was doing a needs assessment about the Catskills last year. And I found this really pretty alarming statistic that in both 2016 and 2017, about 5% of babies born in Delaware County were diagnosed with neonatal opioid withdrawal syndrome, known as NOWS. And 2 to 3% of babies in neighboring counties, I believe it was Greene County and Sullivan County, were also born with the syndrome. That's a lot. Just to put it in perspective, Delaware County was among the top 3 counties in the state of New York in terms of neonatal opioid withdrawal syndrome diagnoses for both those years, right? This was like the statistic that jumped out. What that means is that people are having babies who are then exhibiting some symptoms of this syndrome, which indicates that the parents either were using drugs or were on medication-assisted treatment to help with substance use disorder, or were just engaged in the problems of living in this world, right? When you might have substances that some people think are bad in your body. So that's why we started to put a lens on this as an issue here. I do want to advance this slide and show you just a really briefly. I think this is right. This slide talks about NOWS. Neonatal abstinence syndrome is a huge thing across the country. And the funny thing about it is people think it's just a thing that happens to the baby, right? There are a bunch of symptoms that happen. Here's a list of them. Basically, it's a really cranky baby, right? And when a cranky baby is born in one of our regional birthing centers, like in Cooperstown or in Rhinebeck, and the baby is diagnosed with this syndrome, the caregivers providing for that kid can then see whether or not the mom or the parent has substance use disorder or has been using substances, right? So it's an indication that maybe drugs have been in the picture or medication assisted therapy has been in the picture. Fine. That's where like people used to stop. And this is where stigma comes in. So if you have a baby who's in withdrawal, right? What does that mean? It means that maybe somebody was using drugs or using medication assisted treatment. So that's common. It's not as common. It's not as rare as you think, right? 6% of pregnant people used illicit drugs while pregnant, according to a 2012 national survey. And the stigma that comes along with that is enormous, as you can probably imagine, right? Many pregnant people who use drugs fear that they will be punished and that their children will be taken away if they seek care. And what I mean by care is basic care for themselves and their babies, prenatal care, breastfeeding help, birth and maternity care at a hospital, right? If you've used a drug or you are on medication-assisted therapy that looks like a drug in your system, or even if you've smoked pot and the hospital that you are giving birth in is judgy and prohibitionist about that, they might call Child Protective Services. This is a very real thing, right? What does that do to the mom and the baby who are trying to be healthy and happy and together. It is terrifying and shameful, right? And it also doesn't help a lot with having an easy birth and easy birthing recovery and start to your new life. There are some exaggerating factors with neonatal abstinence syndrome about co-occurring mental disorders and physical and sexual abuse. So folks, may have much bigger issues going on too. This is about trauma-informed care and co-occurring issues. You have to know where somebody's coming from. All that said, the thing we want to do here is support people, and that we can't support people without actually asking why the now stuff is even showing up, right? So this is where I want to stop and go to the fact that this is intersectional, right? This isn't just about babies who have a certain set of symptoms. And it has been thought of that way, but that's sort of an erroneous way of looking at it. It's actually about addiction, stigma, trauma, poverty, and barriers to treating people like people when they come in to seek basic care. So that's why I want to pause. I'm going to stop my screen share. And I want to ask Mary Lou to talk a little bit about being a parent who was using buprenorphine, which is a medication-assisted treatment, while I want her to tell her story. So I don't remember exactly the specifics, Mary Lou, but I want you to tell me a little bit about what we talked about how it worked for you when you had your kids. I'm going to unmute you, dear, or there you go. Perfect.
That helps, huh?
Yeah.
So I'm going to try to condense this to give you guys the information that I feel like that was important to my story. I was addicted to opiates for about 8 years. I had struggled on and off rehabs. Towards the end of it, I was on Suboxone. I was on a Suboxone program. I was in a new relationship. I was not using birth control, and we got pregnant. So I freaked out. I never had a baby born on Suboxone. I didn't know what that meant. I had zero clue. The doctor I was seeing at the time was downstate somewhere. I want to say Liberty. Pretty much told me he doesn't deal with that. It's too much of a risk, and I need to figure out what I'm going to do. And I was like, okay. So at that time, I was going to Bassett for my OB. I have an amazing partner. He ended up we've been together 8 years now, but we'd only been together a few months at this point. So of course I'm freaking out, like, I don't even know you, and I'm newly sober, and now I'm pregnant. So there's a lot in my head at that time. And I found like it was very hard to find support because I admitted, yes, I am an addict. I am in recovery. I have not used anything illegal or illicit since this pregnancy, but I have been on Suboxone. So I found an OB doctor through Bassett who was willing to prescribe me buprenorphine while I was pregnant and do my care. So I would have to go in once a month and get my medication from him. And you would have to be stripped down, and in the bathroom, the nurse watch you pee in a cup to make sure that I didn't have any other drugs in my system, to continue to get my Suboxone from the hospital. So it was all really like a shameful process. I mean, I was already scared and unsure of everything. And I was treated like a criminal.
How old were you?
It was, my son's 5 now, so I was 32.
Okay. Yeah.
During this time, the doctor explained to me that my baby's going to be born with withdrawal symptoms. So of course, that puts this whole load of guilt on your shoulders, but you can't stop taking Suboxone because that can kill the baby and give you a miscarriage. So your choice is you have a baby born addicted. He kind of was like, well, this is the worst case scenario. It's going to be brought to Albany Med and stay there for a month and put on morphine, and you can't have your child. Best case scenario,
like you can't hold your child. Your
yes.
child would be separated from you and given treatment for
Yes.
opioid withdrawal.
Put in an incubator and wasn't allowed to touch them. Yeah. So the day came and I had my baby. I guess I just want to make people aware that it was kind of a joke, for one. They printed out a sheet on Google and had me and my husband score the baby for symptoms.
Those
So if the
symptoms,
baby,
those symptoms I just showed, right? That list of
Yes.
symptoms, basically? Like
yes,
irritability and crying. Yeah.
it was a printout from Google, and I would have to check if my baby sneezed, check if my baby shivered, check if, so already you're stuck in this position of, I don't want my kid being sent to Albany, so I'm trying to downplay the symptoms, but I also want my baby healthy and safe, so I don't want to lie. And I'm not a nurse or a doctor, so I didn't even feel comfortable scoring my child in the first place. There was nobody else in the room there to help me. They'd come in and say, oh, where's your score sheet? Okay, and then they'd take it. I mean, nobody was helping me through this process. It was insane. So we were there, I think 5 days, 4 or 5 days. They had started a morphine taper. And
For your
the
baby.
pediatrician, for the baby, yes, for my baby, because he was scoring high enough. I mean, I think it's like a 6. I can't remember exactly, so don't quote me. There's a certain number, like a sneeze is a 1. Mottled skin is like a 2. So if you have like a certain amount of points, they say, okay, now we'll start the morphine taper within 48 hours of birth. So they started my son on the morphine taper. The pediatrician came in and said, oh my God, this is like the worst case. And I'm like, what do you mean it's the worst case? And he's like, well, he's on such and such morphine. We don't feel comfortable giving him any more because, one, they don't have heart monitors. They have no sort of way of monitoring the baby's overall health at Bassett. So they said, we called Albany, they're coming to get the baby. So me and my husband are crying, and I'm literally having a panic attack. They put him in the incubator. We ride up to the hospital. I'm sorry. It gets emotional talking about
I just want to pause and say, this is like incredibly intense, and we didn't rehearse this. So this is the first time I'm hearing this.
Yeah.
And I didn't realize they took your son like physically to
They
the
didn't tell me
hospital.
they were doing it until the EMTs were in my room taking him.
That's a lot.
Up until this point, I was allowed in the room with him 24 hours a day. I did not leave for 5 days that we were there. I was there the entire time. So now he's being brought to Albany, and they don't let you spend the night in the NICU. I'm not sure if everyone's aware of that, but any baby.
Why not? Mary Lou, why not?
No parents are allowed to stay in the NICU.
Well,
it doesn't matter.
It's an outdated NICU if they're not allowing parents.
Yep.
Yeah.
There was preemie babies. You're not allowed to spend the night. I'm sorry, guys. I'm getting nervous.
Oh, it's okay. No,
yeah.
and we can stop at any time. This is already more than enough to sort of demonstrate the issue here, right? You were sober, you're in recovery.
So
you
the
seem to be
CPS was called too before. And trying to visit me every day.
Wow.
Were
you tested first? It was just because of the Suboxone, right? That's it. That's something you had been prescribed.
I never tested positive during my entire pregnancy for any illicit drugs other than what I was being prescribed.
Okay. Did anyone know about it before you? Like, were any of your treatment providers familiar with neonatal? Like, did they know about it, or was this the first time?
It was the only person that was prescribing me was the obstetrician, or what is that doctor called? The OB doctor.
Yeah,
he was who I was dealing with. So he was the one seeing me for my pregnancy and also prescribing me the medication.
Wow. Yeah, there's just a comment from the audience saying, to Mary Lou, it is so valuable to hear from parents. Thank you, and no judgment here. We're so grateful. I can't even tell you how important it is.
I mean, of course, it sounds very irresponsible, but at the time I was early in recovery. You don't think straight. You're feeling these feelings you've never felt. I was in a new relationship, so I'm feeling all, and that's
to have a baby. Is that what you're saying?
Well, yes, that's what I'm saying. Like, people were telling me, why would you get pregnant on Suboxone? Like, I'm sorry, but it happened. Now what? Like,
sometimes people get pregnant.
Yeah. My family, I lied to family and friends and told them my son had to go to the NICU because I was on an antidepressant, because that's how bad the stigma and embarrassment was for me. The shame was so bad for me that I didn't want people in my community to know. My baby was born addicted.
Yeah. Yeah. And this is
So-
shame, by the way, for not doing anything wrong. Like this is shame for actually
Exactly.
taking really pretty proactive steps towards being in recovery and being sober.
Yeah. And I was doing great.
Not that there's anything wrong
Anyways,
with using drugs, in my view.
we
So,
get to
there's that.
Albany, and this young doctor comes and talks to us, and she pretty much says to me, I don't know why they sent you here. He is on, we have this whole spectrum of morphine we can go. He's on this end, we can go all the way here. I don't understand why they sent him here. He's on the very low end of the spectrum. He doesn't, we're gonna take him, but she's like, he's fine. He's healthy, he's gonna live, he's okay.
Did you not,
so-
were you worried for him? Like, did he seem like he was in great distress? I know you said he scored a
Of
6,
course.
but like, yeah,
Of
but like,
course.
was he crying a lot? Like, what did it look like? Like, what did it
Um,
actually?
It sucks. He was scratching his face.
Oh yeah. Okay. Yeah.
So he had sores all over the place. He had to wear these little gloves. He would cry a lot. He had horrible diarrhea because of the withdrawal.
Yeah.
And like I said, I can't even properly tell you what his actual withdrawal symptoms were because I was the one doing that, which I had no business doing that, but that's
Right.
the job they gave me. So,
Yeah.
I had another kid down the road. I have almost a 2-year-old. The second time I had a different doctor, my Kurt and Lucinda, they were my providers. And I just went to Albany from the get-go. I had a wonderful experience. They treated me like a person. They were great. I had no stigma, no shame. And I wish I would have did that from the beginning with my son.
How did it go the second time? Like when they knew that, like, did the baby still have withdrawal symptoms, but it wasn't
Yes.
treated? So yeah.
The nurses were scoring. The nurses were in there constantly taking care of the situation, talking with me, asking my opinion, but they were doing the job of a nurse by scoring. It wasn't parents scoring. They did not call CPS on me. They were just great. They let us stay there. We'd come every single day and see him. And when I had my daughter, she didn't end up in the NICU.
Yeah,
They
that's what
let
I was
us
going to
have
ask.
her-
They didn't take her away. Now that's
No.
really key. Why not?
And I was on a higher level of Suboxone. Like I was on more milligrams of Suboxone with my daughter than my son.
Wow.
And she was not put on morphine ever.
Oh,
They
wow.
let her, she had a few little withdrawals, but not enough that they said it was enough. So pretty much I was told Bassett jumped the gun and gave him morphine when he might not have needed it in the first place. So they may have created a problem when there was none.
Sure.
They could have just let him ride it out and he would have had a little bit of withdrawal, but they jumped the gun and just instantly put him on morphine, and they weren't supposed to do that.
Right.
So
wow.
anyways,
I don't know.
That's my
I don't know
story.
enough about this. Yeah. That's amazing.
Yeah.
I want to ask you how your kids are now.
Oh, they're great. You would never know my kids were born on Suboxone. You would never know. My son is so intelligent. He is ahead on like all of his milestones, walking, talking. He did everything, a little bit before average. Nothing's physically wrong with them. Nothing's mentally wrong with them. They're completely normal kids. And
you still have custody of them. They're still your kids. So CPS got involved, but they didn't interfere too much, it sounds like.
No, I have 6 children. 3 are older and 3 are younger.
Great.
And I have custody of all of them. And we have a good life. We have a huge, crazy family.
It sounds like you're a great mom.
And I've been clean for 7 years with Suboxone assistance.
Yes, which is absolutely the gold standard for making sure that you can be a great parent to your kids, all 6 of them.
It lets me work a full-time job and be a mother and be a wife. And I think I'm doing really great. So I appreciate, personally, that's what worked for me. I can't sit here and tell you guys it works for everybody, but
I am so grateful for you sharing. I know we talked about how important it was to hear what it actually felt like, because this, the second people hear it from you, it's like, oh, these are the problems, right? Like these providers thought they were helping. I know they did. They definitely thought they were helping. But it was
horrible.
it harmed, right? Because removing the baby is one of the problems, right? That used to be the standard of care. You know, making the mother feel stigmatized because she's doing what she should be doing is another sort of misunderstanding about Suboxone. There's so many pitfalls that I'll go back to when we talk.
Yeah.
But Mary Lou, I wonder if you're willing to take any questions from folks. I think Dennis
Oh,
had one.
absolutely. Yes.
Okay.
And thank you for letting me share my story, everybody. I really appreciate that. I'd like to make
Okay.
people aware of, and I live in Delaware County, so this is a local thing.
That's so, you're amazing. Everyone's just saying you're amazing, amazing. Thank you, thank you, thank you.
Thank you,
Awesome.
guys. Thank you. I appreciate the opportunity. I really do.
You're an amazing advocate is what you're doing right now, which is so cool.
And
Let's
yeah,
see,
Dennis had a question.
Do authorities have a different reaction based on what drug, illegal or MAT, etc.? You might not know the answer.
I don't know
since you
the
were
answer to that.
Yeah, that's
But
something
I
I can
certainly
speak to.
felt
Yeah, go ahead.
like I was treated as if I was smoking crack or doing something illegal. I certainly was treated that way, I felt.
Yeah, and you were not. And look at how it worked out too. Go ahead, Diana.
So do we have any reason to believe that things have changed at Bassett, or do you think there's still a huge a bunch of work to be done to educate folks in Delaware County and our region about how the improving care?
I can't answer. This was 5 years ago that I had this experience.
Mhm.
So I don't know what would have caused a change because I haven't heard anything being done differently. I think they just follow protocol and that's it. So I think until somebody recognizes there's a problem and change it, says we have to do things differently here, it's going to keep happening.
And Julia, this is a purpose of your grant too, right?
The purpose of our grant is to say, hey, there's a problem. The problem is 5% of parents are experiencing situations where they might run into this, right? Like, because their babies are being born with some kind of withdrawal syndrome or symptom. That's a lot of parents, right? But yet nobody really knows about it, right? Mary Lou is, I'm sure, the first person to speak publicly about this in this county, and which is why it's so wonderful that you're doing it. Dennis had another question, Diana.
Yeah, it's a really good question, Dennis. Ask it. This is a huge issue.
You want to just
in our
ask it
county.
on
Yeah, so each hospital uses discretion about calling CPS, question mark. There are no actual standards. I do know that there's an issue with CPS with anybody who's in treatment or using drugs. That sounds pretty much out of control. So what are your thoughts on that, Mary?
I was told that you're even though I was on prescribed medication, Suboxone, that they call Bassett calls CPS no matter what protocol.
So even though somebody's a diabetic and has diabetes and might be on insulin, they would call Child Protective Services?
Well, not unless it would affect their baby, I guess.
Oh.
Because it was not all hospitals do that. Albany does not do that. That's why I went to Albany the next time, but Bassett does do that, and I was not aware of that until afterwards.
Well, there are other medications.
That's something that
I was just going to say there are other medications that can affect the baby in utero and once born. So it's I hope that's on the list of priorities, Julia.
Yeah, I think I think part of what we're doing is sort of figuring out what's happening, right? So stories like this are really important.
And
again, 5 years ago is 5 years ago.
Yeah, I can't say that this is everybody's experience. I'm sharing mine. I haven't really talked to a lot of other moms about it because it's to this day, it's still a shame. It's a shameful thing. It's a guilt thing for me. I'm going to carry this the rest of my life. Even though it had a happy ending, it was traumatic. So I don't walk around talking about this all the time. So I don't know what other people's experiences were. I don't.
Yeah. Well, now that you've told us, this is hopefully going to help other people feel like A, they're not alone, B, this is actually pretty common, and C, we can advocate for ourselves, right? You can advocate for better treatment, and we can also support people the whole way, So that's the point. But it starts with you. It starts with you talking about what it is. Because I can drone on till the cows come home about statistics and whatever. But like hearing from you, I guarantee that's what these folks are going to remember.
Yeah,
That's
yeah.
that's what they'll know. They'll be like, oh, that's how it
That
works.
somebody cares and that there's proactive things being done now. That's just wonderful. It's wonderful because people need that.
Yeah. Yeah. Well, Alicia, who is going to speak in a bit, is up here. She has recovery experience and she's going to talk about it a little bit. I actually am going to ask some more questions though first. So did you say that Albany Med doesn't allow parents to sleep over in the NICU? How much visitation do they allow?
You're allowed there from like 8 o'clock to 8 o'clock. They allow a lot of visitation. I think they let me visit a little bit more because my son wasn't medically in danger. They were pretty chill about it. They were pretty cool about it. I'm not sure what the rules were, to be honest.
So pre-COVID, I want to just point out that pre-COVID,
yes,
the standard, the best practice was that if you're the mother of that baby, you can stay as long as you want. You can be there round the clock if you need to be. So
you were not allowed to stay overnight, though.
That's crazy. Okay.
No, you weren't.
That's not okay.
No.
Casey Miley had a comment about how she can see how this poor decision to call CPS is made, given how much they push mandated reporters to report any doubt or possible concern with the threat of their license in the balance. And they let CPS decide whether there is a concern or not. They're not thinking about the trauma to the parent or the baby, even when it's unfounded, right?
Yep.
And you saying to us, this was traumatizing to me and shaming when I did nothing wrong and my kids are healthy and happy is profoundly important.
I wouldn't have been so upset
guys.
if I had did something wrong, but I did everything by the book, everything I was told, everything the doctor told me to do. That's what ticks you off, is when you feel like you played the game as well as you could, but what you were told, and you were still stigmatized and punished for it.
Your baby was taken away from you. I mean, that's the part of this story that is so horrifying, is that you actually were physically removed from your kid. It's just not okay.
And having CPS come in your life every couple, I think they came and talked to me several times. That's nerve-wracking. I mean, I'm like thinking, oh my God, if I say the wrong thing, are they going to take my kid? Like, even when it's like when you get pulled over and your heart beats, even though you know you didn't do anything wrong. It was kind of like that. Like, I'm thinking, oh my God, what if they make up something? What if they take something I say and twist my words? Or it's just a horrible, horrible position.
Well, the stigma associated with just using Suboxone is so much that people sometimes just think it's just as bad as using heroin, which it is not.
Yes, to some people, I might as well have been still, intravenously using drugs. To them, it's no different. There's a lot of people with that mindset.
And yeah, I want to push the envelope even more on that, because even when people are using heroin, they still deserve to have the best possible care when they're pregnant, and that's, so I know that's not your story, but that's something that I want to just be like, hey guys, this is for active drug users who have no intention of changing that particular behavior. They still have children. Those children deserve the best start in life, the easiest transition, the most support. And, their parents, of course, deserve all the options for treating their substance use disorder if they have it, including access to buprenorphine.
Yes,
or getting help. And one of the things about this grant, one of the things we do is we want to work with folks who are in trafficking situations, who are sex workers, who are people who are in positions where they might become pregnant or might be using substances for economic or poverty reasons, and might end up in the situation really because of outside external factors. And then to compound that with stigma, we need to help these folks. I have some more slides to show about the gold standard.
So there is a question while you're pulling up. So while you're pulling up your slides, there is a question from Deborah about, are there any organized support groups for parents of infants with neonatal abstinence syndrome? Do you know, Mary Lou?
I am not aware of any that I know of.
Interesting.
Nobody was concerned about my support during that entire thing.
We want to start one.
Good.
this is part of what this grant should be supporting. And I think Alicia and I have already been talking about through the Samadhi Community Recovery Center, how to have a parent support group, right?
Yeah.
Within that, there could be parents of kids who actually have nows, but just parent support in general is where we want to start. Parents with SUD or parents who have engaged with substances or parents who use drugs, they deserve support. So yeah, great question. Let's do it. Is the answer to that. All right, I'm going to do a couple slides. Mary Lou, don't go anywhere if you don't want to. We'd love to keep you around because awesome, great. Okay, I'm sharing again in a minute. While I'm sharing, feel free to talk amongst yourselves because I seem to have lost my presentation. There it is. Okay. Present. Okay. Am I back? Is it going? So this is a little bit, oh, well, I'm going to go back a little bit about stigma here. I'm sorry, guys. I'm having some issues. I'm going to stop my share for a second. Sorry, the interruption it made me lose my place. Here we go. There we go. Yay. Okay. Sharing screen. Okay. All right. So I stopped at an intersectional overdose crisis, right? We're in the reason why 5% of babies might be diagnosed with neonatal abstinence syndrome is because there's a ton of folks with substance use disorder who are actively using drugs in our society. And they're for a bunch of reasons, like I mentioned before, poverty, trauma, addiction, all of this stuff. They're overlapping causes, right? And barriers to seeking help. So fear of losing custody is huge. If you know that the hospital is going to call CPS on you, you think you want to go to your prenatal appointments, right? It's just, plus trauma, right? If you have any, like, it sounds like Mary Lou's experience was pretty supportive. She had a great partner. She was just getting on BUP. So she was actually in a really good situation. But if you are unintentionally pregnant and still actively using or something like that, or, in a situation where you're being trafficked or you're doing survival sex work, being able to even advocate for yourself is going to be really difficult, right? Let alone with physicians who are upset with you or think that you're a bad person. Pregnancy and drugs and stigma, active using of drugs. Like, this is a story, I'm not going to play this video, about a woman who's homeless and is using heroin and meth, even while she's also using another medication-assisted therapy, methadone, right? She still needs to get to her prenatal appointments. Her baby was removed from her as soon as she was born and was removed from Amanda's custody. Not because of the quality necessarily of Amanda's mothering, because Amanda was trying to do the right thing, but because there was just, it wasn't really an option in the system's mind to support keeping them together. Here's what I really want to talk about: how to do this better, right? This is an awesome graphic from a great researcher who I have my sources in the, I actually don't have them at the end, but I have a whole bibliography I can share. We want to provide wraparound care for parents here, right? So pre-pregnancy, you want to screen people, know who is maybe using Suboxone, who's actively using drugs. All of your providers should have this on their radar, right? And then, prescribe the proper medications if appropriate. Also provide condoms, Like, if people don't want to get pregnant while they're working with their their addiction issues, make sure that they have access to contraceptives. It doesn't mean you have to use it, but that at least gives people an option, right? So we actually have a huge condom program. We have thousands of condoms. I'm kidding you not. In my office right now. And if you need them, we got them. We're distributing them all over. That's part of what this grant is funding. So all the way to, providing prenatal care and then neonatal care for the baby. And then as the baby grows, you want to keep supporting those parents. You want to keep helping them. You want to check in with them. The most effective treatment combines 3 modes of intervention, right? There's the drug support where you're helping people with the proper medication, behavioral and social services support all at once. That's what you want to be doing. This is another cool video, but I'm not going to bore you with it. It's just, that's for my coursework. You don't need to know about the shame resilience theory. The point here is that we got to widen the lens on this one. That's why Mary Lou's story is so important, right? This is not just about, people who are doing bad things or who are hurting their kids. That's not what this is. This is about people in the middle of a overdose crisis that is racking our country, doing their best to be good parents, all of them. And they need our compassion and support. I have some materials, I don't think I included them in the slideshow, about how blame doesn't work, right? Like the idea of shaming and blaming moms or parents who come to providers needing support there's the evidence shows that the blaming and the taking away actually makes the outcomes for the babies and the moms worse. There's no evidence showing that shame is great in this situation. It keeps mothers away, it keeps parents away, it keeps kids from getting proper care. So you want to support the dyad, the mom and the baby. You want them to be one thing and you want to give them the best possible care. Breastfeed, support, chat box. Let's see here.
Actually, can Tiffany, do you want to just jump in verbally and talk about what you're doing so people know?
Sure. I hate to read my typing too.
I could read it. I just thought you should give voice to it.
So my name is Tiffany, and I am now a community health worker / case manager with Schnagel Health Network, and we're working with the REACH grant and doing a consortium with all of these wonderful agencies. And although there is not right now a specific support group per se for parents in any stage, whether they're current, opioid, alcohol, or substance use disorder patients, or if they are in search of recovery, I am here to help them, whether it's through the criminal justice system, whether they are in care of anybody and they need advocacy. I am there to help them through that, assist them, advocate for them if needed, if they are with a care provider that doesn't exactly embrace the harm reduction aspect of care. So that is my job. And so if anybody were to ever need assistance like that, whether you guys are working with an individual that could use some support and advocacy, or if anything like that, please send them my way, because that's what I'm here for. I'm here to make their life and their transition and things like that a lot easier and be that buffer between them and other things that come along with their journey, if you will.
Tiffany, would you put your contact information in the chat box for everybody to make sure they have it?
I promise to double check the typos.
No worries. I know how to read them because I do them all the time and make those all the time. And then Ashley is asking, how is the Catskills Addiction Coalition going to address this health concern with health professionals, like talking to hospitals about the proper way to support and care for babies and families in recovery, and about their policies and resources and education and training for health professionals about neonatal abstinence? And I'm going to let Julia and maybe Alicia talk about that.
Yeah, I'll start it off and then I'll ask Alicia to talk a little bit about her role. So the CAC and this Neonatal Abstinence Syndrome grant that is procured through Margaretville Hospital are attacking this with a couple of methods. First, we're hiring people to do exactly what we're doing now and what Tiffany does. That's Tiffany, she's way out. She's not local in Delaware County. So we want a Tiffany here. And
Julia,
yeah.
Can I interrupt real quick? I'm sorry. Please. I am working in Schnagel, Otsego, and Delaware counties. So I am working.
I didn't know that.
County. Yes. So if anybody in those 3 counties needs assistance, I'm not sure where we are with COVID, but I'm going to put my phone numbers in the chat and my email. Reach out to me anytime. So I am active in those 3 counties. I'm sorry.
Oh my God. So no, I had no idea. So that's actually, so what I need to do is hook you up with our Neonatal Abstinence Syndrome peer. Help us with some of this basic parent support stuff we're doing. And we'd love to interact with you. That's because you need people to focus on this exact support. So we want to sort of replicate what Tiffany's doing with more resources. So she's serving Delaware County. Awesome. We want to do that with our own Neonatal Abstinence Syndrome peer. And we also, and what we're doing with Alicia is a bunch of stuff, including doula training, which is super cool. But we're also hiring a wellness coordinator who's going to be on staff at Margaretville Hospital, whose job will be to coordinate care and to advocate for folks with neonatal abstinence syndrome at all of the birthing centers and hospitals around the region, right? So if somebody like Mary Lou called our wellness coordinator when her doctor was like, I can't help you, good luck, right? We hopefully would have a way for her to know that she calls our wellness coordinator and our coordinator goes, okay, what do you need? And she'd say, I need this 15 things. And the wellness coordinator would be like, okay, I got to find you this, got to find you transportation. I got to find you the right birthing center to give birth in. I need to maybe get you a coach who maybe can be with you while you're giving birth and help advocate for you afterwards, or at least, and then do home stuff afterwards. That's what the wellness coordinator role is. If you know anybody who's interested in that job, we're taking applications right now. And when I stop talking, I will put a link to the application in the chat box. So those are the two ways, really hiring people to pay attention and advocate for this particular issue. We are also doing outreach just like this, information about what this is. Like one of my jobs is to say, hey, did you know 5% of babies in Delaware County are born with withdrawal syndromes? And this is the way that we should help with that. Every time I say that sentence, people tell me, but there's no birthing centers in Delaware County. And I go, yeah, I know. Like that's because people are going to faraway places, having their kids and coming back because it's hard to get prenatal services in Delaware County, right? Like and we also have a high rate of substance use disorder. These things all go together. I want to bring you in, Alicia, if you would unmute yourself and put yourself on video, just so we can talk a little bit about what you do. Hey, dear.
Hello, how are you?
Dude, Tiffany is going to help us out so much. I'm so excited.
That's amazing. I'm so excited about all of this. So yeah, my name's Alicia Griffin, and I'm the maternity and parenting certified recovery peer advocate for Margaretville Hospital. I first want to say thank you so much, Lou, for speaking. I think that's amazing. And that's what we need more of, is people out there saying exactly what they've been through, and how we can help, because we are trying to reach out. And like you were saying before, like wrap around with every type of support we can give to people, but we need to know exactly what it is too. And also congratulations on 7 years. That's a huge thing to be so proud of.
Yeah.
So let's see. As the peer, I can try and offer like peer counseling to people who, like we said before, can become pregnant, who are pregnant or have recently had children. And I think that's also where the doula comes into play. So I am in the process of getting the doula training and certification. And that's to help throughout the next couple months after someone has the baby, and make sure that that mom has all the supports that she can get. And to actually, I feel like, have a little bit of pull with the hospitals. So what we were just saying is, how are we getting into the hospitals and making sure these moms and parents have the right support, is I feel like we have to actually get into the hospital. And I think that having the doula training and a lot of experience of women who have gone through, or parents who have gone through these situations, is going to be so beneficial. And we are in the process of speaking to a couple different hospitals and birthing centers right now. So that's great. And a lot of it is support with assistance with prenatal and self-care, with postpartum support, getting people linkages to health insurance if they didn't have any and they find out that they're pregnant, or healthcare facilities that we have good experiences with and that we know it can be a nice outcome for that family and the babies. And like Julia was saying before, like meeting people where they're at. If someone is out on the streets and homeless and still using, and almost to try and offer supports in any type of way, whether it's getting them out of a bad situation and into some type of shelter, a safe place to live, and have a decision on if they're going to go through with that pregnancy even, because not everybody is going to have the same opinion. To offer the medication assisted treatment providers to get them going in the right direction if that's what they want to do. Let's see, different connections with doctors' offices, community agencies. We've been doing so much research with different agencies and how to get diaper supports and condom supports. Like we said, we've got about 30,000 condoms to just give out. Yes, it's a lot. My whole basement is covered in condoms.
Yeah, she didn't know that was going to be part of her job when she.
Yeah, I didn't either. So that was fun. And then connections for recovery supports, because a lot of this is showing people how to get out of that lifestyle. Like, yes, once you're on medication assisted treatment, and we want to be there and support you when you're in the hospital and make sure that you don't feel stigmatized. That is absolutely one of our main goals. But I feel like a lot of the time we're meeting people when they don't even know what recovery is, what that lifestyle could be. So a lot of it is just giving connections for supports, for family support groups, AA, NA, HA, refuge recovery meetings. To answer one of the questions, there is, and I don't want to give all full information yet because I don't want anyone showing up today because it's not in, form today, but we have a parenting support group starting at Samadhi. So it'll be here in person or in Zoom on Wednesdays with childcare providers. So if you want to and have to bring your children, we are going to have babysitters in the room right next door. And we're hoping that that's going to help our community also. And then have it pushed up to Delaware County also, because I know we need the support up there. Yeah, I don't know. I think that was about it.
That's amazing. I didn't even know about that. We'll share the link to the Zoom support group. I mean, that's the kind of thing where I hope Mary Lou would consider showing up to that and sharing her story, because I bet that would be, oh my God, phenomenal for people to hear.
Mention something? I think one of the barriers, obstacles, is making people aware of these things, especially people who are still on the street using or out, whatever. I don't know how we would make it. Do you know what I'm saying? Like advertising that these things exist. I had no idea these things existed. I wish I knew Alicia at that time, but I never even heard of such a thing. So getting the word out there is one of the things you guys are going to have to.
Absolutely.
So, so actually this could be integrated into some of the outreach that that all the peer advocates are doing, right? I mean, maybe we have a palm card that they can hand out with information on.
Absolutely.
Yep. We're experimenting with that. And Dennis, who was just on this call with us, who's the CAC's staff peer, has already been sort of just incorporating what we're talking about into his peer work. Talking to folks who might be on the street using, about how to access these resources. But there's nothing like having a face to throw people to. Now that we have two, I'm even more psyched about it. But yeah, this is another reason why we want to talk with Tiffany about her outreach work, so we can also see what works really well, right? Like the more coordination we can do, the more people know that this exists. Educating providers is huge. We do need to have like more one-on-ones with every OB who's working in this region. I do plan on working with Bassett. We actually do have a partnership with Bassett. It's not that I haven't gotten into the OBGYN department yet, but that's the plan, and to sit down and say, hey, how can we work together to make this process smoother and more comfortable? Advocating for like different policies about when you call CPS is something I'm interested in doing. I think that's really important. I had a peer last summer, Paul Fontana, who ended up really going down this rabbit hole with CPS advocacy for parents, right? Just helping empower parents when they're working with CPS to make sure that they're not sort of blindsided by the process and they have agency, which also helps with shame and stigma and just like, so there's a lot of work we can do here. I see that we're almost at time. I would love folks to jump in with questions, comments. This is really exciting stuff. And we also are throwing spaghetti at the wall a little bit, trying to figure out what works. So like your ideas about how we can reach people and help ease this whole process to make it a supportive one. I'd love your ideas, like places where Alicia can go, where Tiffany can go, alliances we can forge, support groups, ways to reach parents. We have a whole parent pantry where we give out free diapers and formula. That's a way to sort of give parents support. And we haven't figured out the best way to do that yet. So ideas about that are welcome too. So I'm opening it up. I'm gonna let a little bit.
So if I could for a second, I've actually already started reaching out to the police departments and the hospitals and to PCPs and OBGYNs and other agencies to let them know that we are here. And once we are getting a pamphlet together and a resource guide, that's one way we're reaching out to people, let them know, hey, we're here. If you have individuals that need something, contact us, because that's what we're here for. Also, when COVID slows down and we're not afraid to like breathe air again, I plan to go out on the street and just kind of like go to spots where people feel safe to do what they need to do, but also hand out literature there and say, hey, we're here if you need support and advocacy and love, and get you where you need to go or what you need. So just so you know, we've already started implementing those things, which I'm really excited about.
Oneonta has a great, I can't think of the name of it, of course, but they have a great
Friends of
little
recovery.
Yes.
Yeah.
That was during my active addiction. I found they were really helpful. They pretty much, it's just a safe place. If you're on the street and you have nowhere to go, they say you can come in and read a book or use the computer. So that was a nice place, but that's also somewhere that I think if you guys had your information available there, people could reach out to you.
Great
Yep,
idea.
that's one of the places we've reached out to.
Oh, good, great. That's the only one that just pops in my head, that's all.
And we have about 2 minutes left.
I just want to make a comment that I'm glad to meet everyone. I think it's great work that's being done. I'm coming from the mental health field. I'm a child and adolescent psychologist, and I just want to keep encouraging you to go forward. I would say about 20 years ago, I got involved with the movement Parents with Psychiatric Disabilities, where in some family courts around the country, if you had, you know, a serious mental illness, you were hospitalized, your kid was removed, just based on that, not based on any assessment of how good a parent you are. And there have been some tremendous parents with those problems who have a plan, they have family backup. And so I think all I can say is one of the things that helped alleviate that problem, and I think it's much better now, is having some attorneys on board with you, you know, just to encourage the child protective system, the family court system, just to be able to differentiate between a parenting problem and, in your case, a substance problem. And there, for sure, parents with substance problems who are great and some who are awful, and they should be judged on the merit of how they're doing as parents. And it's the same with that. So that's the only idea I have to put forward, but keep on keeping on.
I super appreciate that. I got booted for a second. Sorry. Yeah, we're wrapping up and I have to do a 1 o'clock. Is there any other comments? Input is really amazing. That was super helpful. We really do need ideas. I think we have time for like one more.
So maybe I could just add that people can email the coalition at Catskills Addiction Coalition @gmail.com, Catskills Addiction Coalition @email.com. I've put in the chat the link to the evaluation form and to the a form to be able to get a certificate of attendance today. I want to just go ahead and just do a bit of a wrap because it's been an amazing session. And I want to personally thank Mary Lou for just jumping in. Kudos to you. Really important storage. And Julia's right on target with, you know, you can show the slides, but when you have the human story, it just all brings it together and makes sense. And it just, the impact, it's just painful to hear what you had to go through. But I want to thank you. Yeah, thank you. And I'm sure we'll be calling on you again.
Only if you want to, but you killed it. It was so
absolutely. I'm absolutely whatever I can do to help. And
Julia Reichel, you're amazing. Thank you so much. And Alicia Griffin, thank you so much for this important work.
Tiffany too.
And Tiffany.
Thank you, everybody.
Yeah, we have a lot of work to do, but I'm really encouraged by this session and excited about how we're going to transform this region. So you can get I've mentioned the evaluation certificate of attendance, and you can get a video of this session by going to catskillsaddictioncoalition.org. Give us about a week or so to do it. I just want to point out that we do have some other sessions today. Today we have at 2 o'clock, actually, Julia is going to be moderating a session on syringe exchange, which is really important. And then she'll be moderating a session, and that is at 2 o'clock. Then she'll be moderating at 4 o'clock a session on Be a Business That Makes a Difference and how we can build out recovery-friendly businesses. And then at 5 o'clock, I'll be facilitating a second Narcan training session, The Science of Addiction and Overdose Reversal. That will be at 5 o'clock. If you are not registered, if you want to attend any of those sessions and you're not registered, just go to our website, catskillsaddictioncoalition.org, and you'll see how to register to be able to participate in this session. Thank you very much for excellent session and for all of you who've participated. Thank you. Thank you.
Thanks so
Thank
much, guys.